My name is Alexandra Zens, and I'm the Deputy Finance Manager at Nuffield Health, Cambridge Hospital. Nuffield Health is the UK's largest healthcare charity, and throughout the crisis has made its 30 hospitals available to NHS trusts nationwide, alongside other independent healthcare providers. I've been with Nuffield for the past 3 years, and in those 3 years, our hospital in Cambridge has seen massive growth and has been a very exciting place to work. I'm also a member of the CIMA East Midlands and East Anglia Area Committee, and I've been a student representative on the Association's UK Regional Advisory Panel for the past 3 years. I passed my strategic case study in May 2019, and as of March this year, I am a fully qualified CIMA member and CGMA. A main part of my role, aside from preparing the monthly management accounts, is business partnering with other heads of department, preparing forecasts, analysing costs, and focusing on business development. These aspects of my role have effectively been placed on hold, as our hospital has become a specifically COVID-free centre to support NHS oncology patients. Instead, as a finance team, we've had to work hard to understand new and constantly changing reporting requirements that perhaps initially have little to do with our day-to-day finance work, but require our analytical skills in a different way. One professional challenge for me has been managing a team that is used to working closely together in a small office, but has now had to disperse to work from home. Managing tasks and performance can be difficult to do remotely, even when we are concentrating on aspects of our job that have not changed, such as managing cash flow. It has been a challenge to ensure any changes are cascaded to all relevant people without becoming overwhelming, confusing, and potentially contradicting each other. We've put in place clear structures as a team to stay connected and stay focused, including a daily call to discuss tasks and priorities, as well as a weekly virtual pub quiz to keep connected outside of work. My biggest personal challenge has been the lack of face-to-face engagement. I enjoy the business partnering aspects of my job, which often involves sitting down with my fellow heads of department to review strategies and development plans, which have now been superseded by different priorities. Furthermore, with many of the hospital staff working directly with patients, I'm very aware that the best way to communicate is usually to go and speak to them in person, since they are often away from their desks. But in the last few weeks, I've had to rely on communicating by email and messenger, which makes it harder to find that personal connection. As the situation is evolving, finance teams need to remain agile and reactive to any changes. However, financial implications will continue long after the world has returned to, or perhaps adapted to, the new normal. There have been decisions which have needed to be made quickly, and perhaps with limited information at the time. Those decisions will have implication longer term. So finance teams should start preparing audit materials and backing data at this stage in order to prepare for reconciliations and reviews. At Cambridge Hospital, we are proud of our resilience and ability to adapt to changing circumstances. Personally, for me, resilience can come from knowledge of your own business and your own market, but also from acknowledging areas of strength and weakness. I have used this period to reflect on gaps in my knowledge and experience, and have participated in some online training courses. I've also found it helpful to read widely on non-COVID related subjects and non-work related subjects, including rediscovering my passion for literature and poetry, which opens up new and creative ways of thinking that I can apply to my day-to-day work. Considering the industry I work in, which is private healthcare, I do not see any significant changes following the pandemic. Our business will need to adapt based on new guidelines from the NHS and from Public Health England, as we've done for so many years. We worked closely with our local trust before the pandemic, and we will continue to do so, even when the NHS starts to perform elective surgeries again, and we return to being a private hospital. The finance function is a central part of any business, and I think this crisis has only brought that to the fore. As we emerge from lockdown, there will be new opportunities for finance professionals. This period has shown us that working from home is possible and will hopefully encourage a more diverse workforce, both in terms of location and in terms of accessibility. Finance professionals will be key to restarting the economy by providing strategy advice, as well as stewardship over a company's assets and resources. My advice to any CIMA member and student would be to be open-minded about change. and to always question whether there is a better, more efficient way of working, even if it goes against the traditional ways of working. In this ever-changing world, everything is moving faster and faster. It is likely that companies will be adopting different approaches going forward, and it will be essential to be agile. No matter whether you've been a CIMA member for 15 years or you're a student that is just starting out, it's your creativity and your innovative ways of thinking that make you stand out and will help you